A lot of people are asking questions about the safety of steroid shots, and these are commonly used for all types of joint problems, particularly knees and hips and shoulders and so forth. The bottom line is they're destructive, and in the long term, they will make problems worse. A couple years ago, in 2015, a study came out, was published on MedLinks, which is a internet medical research clearinghouse. And they talked about two studies. One that was done at the Mayo Clinic, and they found that these corticosteroids, when they were used for injections of joints and for analgesic and short-term pain relief and so forth, had a toxic effect on the what's called the mesenchymal stem cells. And these are the stem cells that continue to rebuild and replenish damaged soft tissue, tendons, ligaments, and so forth. And in the long run, the problem got worse. And instead of helping it get fixed or corrected, it deteriorated further. And about that same time, another follow-up study, or a separate study at the University of North Carolina at Chapel Hill, did a study of 33 patients that had hip injections. Now, these were hips, but you could relate this to the knee as well. And they found out of the 33, 32 of them had significant decrease in joint space. And after about 6 months of using this corticosteroids, they found that 1/3 of them developed bone-on-bone degeneration. So you didn't help yourself at all, or they didn't, and you're not going to help yourself at all by continuing to use steroids occasionally. I know that they will only give you so many at a time or over a certain period of time, but still repetitive use will do this. And the older you are, the more of a disastrous effect it's going to have, because your stem cell levels drop the older you get. And the majority of people that get them are in their 50s, 60s, 70s, and so forth. Rarely do very many young people get them unless it's for an acute injury or something like that. So stay away from the steroids. There's many other things that can be more effective. Laser, pulse magnetic field, trigenics, joint decompression, things like this that stimulate natural inherent recuperative power of your body to regenerate and to correct this. As a matter of fact, the study done at the Mayo Clinic said these agents may hinder the innate regenerative capacity of mesenchymal stem cells in exchange for temporary analgesia. So just keep that in mind. Stay away from them. Your joints will be healthier in the long run, and there's a lot of other alternatives that'll work better in the long run.